Hi, I'm Vinny Baylarian and this is Samantha and we're with ProMotion Physical Therapy, and today we're going to do a short video on proper seat or saddle height on a bicycle. When adjusting saddle height, what we want to look at when we have a person on the bike is their foot will be at the bottom of the pedal stroke, and the bottom of the pedal stroke is actually when the crank arm is lined up with the seat post, not when the crank arm is at the 6 o'clock position. So it's important to keep that in mind, having the crank arm in line with the seat post when you're adjusting seat height, because this is actually the bottom of the pedal stroke. So the first technique we're going to show you is one you could do if you're by yourself without having anybody to give you a hand. With your shoe off and your heel on the pedal, what you want to see is your knee totally extended, and again, that crank arm is in line with the seat post. So once Samantha gets her shoe back on and she's actually pedaling normally, this would be generally a good seat height for her, because again, her knee is straight with her heel on the pedal and the crank arm is in line with the seat post. The next technique will actually measure the angle of the knee, and again, Samantha's at the bottom of the pedal stroke, but in this case her shoe is on and her foot is positioned on the pedal more appropriately as she would have it if she was actually riding. For this technique you'd have to have a partner or somebody to help you out. What we're looking for here is the angle of her knee should be between roughly 25 and 40 degrees, and there's room in there to adjust for personal comfort. But what we do is we line up the greater trochanter, or the bone on the outside of your hip, the midline of the knee, and the lateral malleolus, or the outer ankle bone. So we position the center of the goniometer at her knee joint with the arms going to the greater trochanter and the lateral malleolus. And right here she's about at 25 degrees, so this would be a pretty good height for her. But again, we want a knee flexion between 25 and 40 degrees. After we get the height of the saddle set, what we're going to look at now is the fore-aft position, which is how far forward or how far backward the saddle will be on the seat post. With the pedals at the 9 o'clock and 3 o'clock position, what we're looking at is the kneecap, or the patella, should drop down and bisect the pedal, or the spindle of the pedal. So what we use is we'll use a thumb bob off of Samantha's kneecap, and it is actually in a good position right now. So this allows the most efficient pedaling, allow her to transfer the most power to the pedal. Some of the common problems we'll see if the seat height or position is not adjusted properly is that if the seat is too high, when the person is pedaling, when they're at the bottom of the pedal stroke, they really need to extend that leg and the knee. We'll see pain in the posterior or back part of the knee, most common a hamstring tenderness or a tendonitis. We'll also possibly see the pelvis or the hips rock up and down, which can lead to low back pain. If the seat is too low and the knee is not extending enough, what we see there is anterior or pain in the front of the knee, and that's caused by a compressive force on the kneecap or patella into the thigh bone. We may also in that situation see the pelvis rock again as the thigh comes up. If it's coming up too high, it'll tip the pelvis and again rock it back and forth, possibly leading to hip or back pain. We hope you learn a little bit more about saddle position, and if any of the conditions or ailments we discussed apply to you, feel free to give us a call. We could check out your position on the bike, bring your bike up to the clinic, and we could look at how you're positioned. We could also look at your body. Physically, you may have some limitations which aren't allowing you to achieve proper saddle position on the bike, causing some of these conditions. So once again, I'm Vinny Baylarian, and this is Samantha, and we're with ProMotion Physical Therapy. Thanks for watching.